How to differentiate a common cold from a H1 influenza pneumonia or a complicated flu infection? First of all, we have to know what are the symptoms of a cold. If you get a fever, headache, sore throat or a running nose, we suspect that we are suffering from a common cold. Now it is very important to differentiate it from the H1N1 influenza. So the symptoms of cold, when it is present in a very severe intensity, and if you have a severe body pain, or if there is some alarming symptoms of influenza. So what are the alarming symptoms? If you have a chest pain, breathlessness, or if you are coughing a green sputum or a blood stained sputum, you have to immediately consult your doctor. Again, there is another group, it is called high risk group. So if you get a flu in a high risk group, that also an immediate attention needed situation. So what are the high risk group people? People who have diabetes, bronchial asthma, patients on chemotherapy drugs, especially cancer patients, or patients have a underlying lung disease. So these patients, if they get a flu infection, immediately they have to consult the doctor instead of waiting the flu to relieve on its own. Then third most important point is how to prevent the flu. Immediately when you get a flu, you have to take rest and drink plenty of warm water. If you have a body pain and fever, take a paracetamol and don't jump to start any antibiotic. And you need to have a self-isolation. Self-isolation means you need to keep a distance from your family members, or especially if you are an employed person, you should get a rest from your duty for a few days. So this is how we identify, we prevent and we treat a flu and a complicated flu.